Is it a big problem?
No, not that. Okay, the recurrent APHTOUS STOMATIS. Pancreas recurring ulcers from the oral mucus. And osteopathogenesis, this is the genetic one from the HLA, 40% nutritional iron, folic acid. That's a good reason to get it. An endocrine and premature pregnancy, infective step changes, stress, smoking cessation, trauma, and immunological. The clinical features: 20% of general population have APHTOUS. Periderm 2 to 48 hours, and peri-ulcerative, and this is ulcerative also, and resolving. These are the clinical features. This is a figure of that, another figure. This is another figure on the small tongue figure. No. Three types of APHTOUS we have: minor, major, and herpetic one. The number of the blisters, the size of that, and you see the size of the minor one is 2 to 4, and the major is more than 1 centimeter. The healing time is 10 days, 6 weeks, and 10 days for herpetic one. And this is the non-keratinized, keratinized plus non-keratinized, and non-keratinized after that. In the disease, simulating grass, the Bichet oral genital neuroaquila. This is the Bluetooth one. I can come here and see this better. That's very hard to see that. Sorry. Now the cyclic neutropenia and the Reiter disease also. For the management of the stomatis, we should ask a history of the patient. Do you have stress? Did you have trauma, smoking, and permetrational failure? And for the clinical examination, we should examine eye, genital, rectal, and CNS. But this is the job of the medical doctor, actually. For the investigation, CBC, serum iron B, and ANA. For the general measure, stress avoidance, B12 supplement, folic acid, iron, B complex, C complement, and P and probiotic are good. For the topical therapy, in the mild cases, to promote healing, use 0.1% triamcinolone with aura-based kit, 2% xylocaine, viscose to relieve pain. So in the severe case, use the clobetasol plus fluocinolone, tetracycline in 30 milliliter water, and 5% amlexanox paste, accelerate healing goals. This is a treatment of the APHTOUS stomatis. And in the severe cases, we can prescribe for the patient prednisolone 1 milligram per kilogram per day, taper over 2 weeks, and azathioprine 50 milligram, and watch for candia disease also. Prevention of reoccurrence, oral pentoxifidine 400 milligram 3 times, and colchicine 0.5 milligram, and also DDS plus colchicine. That's good. Prevention of reoccurrence is thalidomide 100 milligram for prevention to don't get it, and also, but the thalidomide, you know, that's we know it as a teratogenic drug in 1963, and other measures for topical tacrolimus and levamisole that also we can measure. Points of ponder. These are the cytomegaloid, Epstein-Barr, handiness, gluten-free, non-enzymatic, ionophoresis, and detergent in toothpaste. These are the points that we can trigger the APHTOUS. To summarize, it means that for stomatis APHTOUS, stress avoidance, soft toothbrush, supplements, B12, folic acid, B3, vitamin C, iron, steroid with oral base, local anesthetic like lidocaine, benzocaine, we can spray it, tetracycline mouthwash, and systemic steroid severe cases. These are the summarized derived for that. And pentoxifilin, colchicine, and also steps assisted thalidomide. Now about the oral medicine, blood presentation, APHTOUS ulcerus, because it was another type of ulcer in the OTC book. I just summarized this. It has a reoccurrence also, and infiltrated. We can use because unfortunately it's not good. I can just go to the blood part. You see, this is the APHTOUS ulcerus type. This is a painful open source inside the mouth. This is the other type of the Sanger sore. 4 types it has, the mono, major, herpes, and reoccurrence. We just go, I don't want to go into very fast, unfortunately. Sorry. See this one. For the treatment, for the early treatment, avoidance of the trigger is good. And supplement care, symptomatic care, anesthetic, covering agent, compound, and you mentioned all of them before. Can I read it again? No, thank you. And also the OTC treatment of APHTOUS ulcer is like a herbal remedies. For example, rock rose 1:1 ratio sachet and chamomile mouthwash plus echinacea. And cleansing agent, for example, hydrogen peroxide, toothpaste without sodium lauryl sulfate SLL, and vitamins, dietary supplements, vitamin B, vitamin C, zinc, lotion, L-lysine tablet. For the local treatment condition, we can use the patients with Behçet disease, also medical statement. That's not good. For the treatment of the major case, the thalidomide 200 mg, antimicrobial drugs to reduce secondary infection, and anti-inflammatory agent including 5% Amlexanox. And topical anesthetic also, that's good, elo for eating. These are my reference. And for the herpes virus, a little bit review that a lot of different type of herpes virus we have. This is a type of the virus, DNA virus, herpes virus 2. And about the herpes simplex virus, the varicella zoster, herpes 1, DNA virus, microbiology 1, I don't want to go to detail. I just put it here to have a very nice lecture. And about the clinical manifestation. Herpes virus is involved in variety of clinical manifestation, which includes acute gingival-stomatitis, herpes labialis, ocular herpes, herpes genialitis, herpes cutaneous, meningitis, encephalitis, and neonatal herpes. This one. Oral facial herpes, exactly, we had it before. This is a shaped figure of that. Ocular herpes, that's very bad. Okay, this is neonatal. This one not. These are for diagnosis for GP. And how about the management? We can use the acyclovir, the drug choice for the most situation present in the available. For the herpes simplex infection in normal and immunocompromised patient also we can use it. It has an IV form, oral form, cream form, and ophthalmic ointment, the sterile one. And the famciclovir and valacyclovir, oral only, more expensive than acyclovir. Other older agents like edoxyuridine and trifluorotimidine and vidarabine, RA. These agents are highly toxic and it's suitable for topical use for ophthalmic infection only. About the varicella zoster, you don't want to speak about the varicella, okay? I skipped this part very fast. This is the shape of the varicella. Herpes zoster, shingle. These are the variety type of the herpes, actually. This is the management of this by acyclovir again on varicella. And about the cytomegalovirus, We don't want this also because it was
It's
in
not the topic.
It was on the OTC book. I just read the
It's
topic.
not the topic of the lecture.
Yeah. Congenital suicidal incident, cytomegalovirus, laboratory diagnosis, test, treatment. Treatment is again like acyclovir and Epstein-Barr virus. That's a very nice idea. I just skip it. Other human herpes, we don't want it. Kaposi sarcoma, after the AIDS is associated with the AIDS people, unfortunately. They have the Kaposi sarcoma, and this is the acyclovir is also can be a drug of choice for them. Well, where is the other one? It was here. Because I put the table here of the drug of choice. It's not here. About the oral discomfort table, I collect the table data for that. It's not here. I don't know why. But it was a very important table on the book for the oral discomfort table. If somebody have an oral discomfort table, we can suggest them 3 types of the drug. First of them is a mouthwash rinse, and this mouthwash rinse could be antimicrobial, and we can give them the lidocaine just for gargling, and benzyl chloride and benzocaine chloride. And the third type was like a mouthwash, but they are not mouthwash. They can gargle and then eat it. It was 3 types of the drug. I just remember it from the book, and I don't